This is Newsmax TV. I'm Ashley Martella. We're pleased to be joined again by one of the most influential U.S. senators in the healthcare overhaul controversy. Iowa's Charles Grassley is the top Republican on the Senate Finance Committee. Welcome back to Newsmax, Senator.
Oh, I'm always glad to be with you, and thank you for elucidating on these very important issues.
On your website, you've posted a notice pointing out that the nonpartisan Congressional Budget Office sent a letter to Senator Evan Bayh, the Democrat from Indiana, that spells out what will happen to health insurance premiums as a result of the Harry Reid health overhaul. Apparently, it's not a pretty picture. Could you please discuss that with us a bit?
Here is what will happen on premiums for health insurance under the Reid bill. And this is, in fact, based upon the report of the nonpartisan Congressional Budget Office in this letter to Senator Bayh. And for the, particularly for the group of people that have individual policies as opposed to group insurance policies, their premiums will go up 10 to 13%. And a lot of other premiums would go up, except for the fact that there's heavy subsidies in this bill. They're taxing Americans $500 billion, and they're taking $464 billion out of Medicare to give subsidies to other people that would otherwise have their taxes go up, and that's about 7% of the people that would get some benefit from that, but the other 93% of the people are paying for it. So you can see that, that when premiums go up for individuals, they tax 93% of the people to keep other people's premiums down. This is really quite a charade.
All right, you also mentioned on your website that people will not only wind up paying that 10 to 13% more for their premiums, but now they're also being forced to buy insurance under huge financial penalties for noncompliance, as well as possible prison time. The CBO pointed out some weeks ago that never before in American history have citizens been forced to buy anything. I know I'm asking you to speculate, Senator, but that requirement alone seems so preposterous as far as its encroachment on our freedom. It raises the question why there hasn't been more outrage over it. What do you think?
Well, I think there is a lot of outrage over it. It's not getting the central attention that it ought to get because of the big increases in taxes and, more importantly, scaring senior citizens to death by taking $464 billion out of Medicare so that they think they're not going to get the health care that they paid for taxes for throughout their life. But I believe that it needs the scrutiny that your question gives it, because this is, in fact, the first time in the 225-year history of our country that anybody said you had to buy anything. Now, somebody's going to point out to you that states make you buy car insurance, but don't forget, states have a lot more power under the 10th Amendment than what the federal government has under the Constitution delegated to it. So this philosophically is a bad thing, but it's particularly a bad thing for people 20 to 35 years of age who tend to not buy insurance, or who do buy insurance are going to see their premiums go up very dramatically.
Senator, in your opinion, are the Democrats trying to whitewash or at least obfuscate the fact that insurance premiums will be much higher under their bill?
Oh, if you could watch this debate and listen to this debate over the last several days on the floor of the United States Senate, they don't even want to talk about it. But when they do talk about it, it is nothing short of obfuscation.
All right, the $500 billion cut in Medicare. Please explain for us how that impacts seniors.
Just stop to think of it. If you were 65 to 85 years old and you had been paying payroll taxes into the Medicare trust fund, wouldn't you think that it's a little illegitimate to take money out of a trust fund to set up a program for people that didn't buy insurance? Wouldn't you expect them to assume their own responsibility for that? And so that's number one. Number two is, the way it's coming out is $120 million out of Medicare Advantage, which means that premiums are going to go up for those seniors that are on Medicare Advantage. And don't forget, there's about 11 million seniors that do have Medicare Advantage as opposed to traditional Medicare. And then there's $155 billion coming out of hospitals. Now, maybe urban hospitals can afford that, but we have a hard time keeping hospitals open in rural America, and it's going to cause some of those hospitals probably to close. And if there aren't hospitals, or you aren't paying doctors what you should, you know, are the services going to be available for our seniors that paid into Medicare a whole lifetime?
One of the major factors in the cost of healthcare reform is sky-high medical malpractice premiums some doctors have to pay because of frivolous lawsuits. Now, in all your discussions on the Finance Committee, has the issue of tort reform even been brought up in a nonpartisan manner?
The issue of medical malpractice tort reform has not been interjected yet in an amendment, but it has been brought up in several speeches by Senator Hatch on our side of the aisle, and can you believe it? There's Democrats that are defending no tort reform. And how can you defend anything when the increased cost of medicine is about 10% of the cost of medicine, just because doctors give you tests because they think you're going to sue them and they want to protect themselves from lawsuits. And 10% of $2 3/10 trillion is $230 billion, and that's real money being wasted. And we do need tort reform. We need tort reform like what they have in Texas, where there's limits on punitive damages, and you have a whole new environment for the practice of medicine. And you don't have those high premiums for tort insurance that you raise in your question.
All right, if you could give us your best guess, what are the proposals to remove the state barriers against insurance company competition? Why are those proposals going nowhere?
I think that the existing insurance companies don't want more competition, and that's why it's not going anywhere. But that's another issue that we intend to bring up before this debate's over.
Does Harry Reid have the 60 votes he needs to ram this health reform package through?
Not yet, or he would have filed cloture and brought this to a debate, because they really don't want any amendments. They don't even want to talk about these amendments. They don't even want you to know what's in this 2,074-page bill. And we've only been on it 1 week. But stop to think, it took him 3 weeks in the secrecy of his office to put together this 2,074-page bill, which is a combination of what came out of my Senate Finance Committee and what came out of the Senate Health Committee. So if it took him 3 weeks to do that, he surely wouldn't expect it to be debated by 99 other senators in the course of less than 3 weeks, surely.
Are you hearing any talk of Reid possibly using reconciliation to pass his bill with only a simple majority?
No, I have not heard talk about reconciliation, but I wouldn't preclude that if they don't get the 60 votes that they need. They may try to go that route.
Okay, so the so-called nuclear option is not off the table then, despite what he said in the past.
I got to be fair and say it hasn't been talked about a whole lot in the last month, but I think that it's a shotgun behind the door that you got to consider could be used. And you got another thing you got to think about when you about getting these 60 votes to get it passed or using the nuclear option. You got to think in terms, this is a president with a 60-vote margin in the United States Senate, and this is his #1 issue, and there's always a great deal of pressure for a president to win on his #1 issue, particularly the first year in office. And if they don't get the 60 votes, I think you either have a nuclear option or you have a compromise of something less than what's in this 2,074-page bill, and that something else will be anything the president can declare victory. There's some talk that the president said if the bill says nothing more, then we're going to supply H1N1 vaccine to everybody in the United States, and it's covered by the issue of health care reform, and they sign it, they're going to claim victory.
All right, Senator, one final question having nothing to do with health care. Are you pleased with what Obama's doing in Afghanistan?
You know what? During this interview, we've said an awful lot against Obamacare. I think that I ought to compliment the president for doing the right thing. I can find fault with him for not doing it 3 months ago. I can find fault with him dithering. But for once, like on health care, the president is not carrying through on a lot of campaign promises. But on this one, he said in the campaign, Afghanistan was very important, more important than Iraq. He wrote a new strategy in March. He fired a general that wasn't delivering. He hired McChrystal. McChrystal says he needs more troops. Those troops are going to go over there now. So I think we ought to say the president in this instance is doing the right thing.
Iowa Senator Charles Grassley, as always, thanks so much for sharing your thoughts with us here at Newsmax.
Okay, thank you very much.
And thank you for watching Newsmax TV. Sarah Palin's new book, Going Rogue in American Life, will be released on November 17th. You can be among the first to get your copy. Check out our incredible free offer for Sarah's new book. Just go to Newsmax.com and click on the top banner for this great offer. Act today.